What's your name and where do you come from?
My name is Godfrey Yoni. I'm a veterinarian. I come from Zimbabwe. I studied in the University of Zimbabwe. I've been in the industry for about 10 years now. Been in the region for 4 years. And my journey to being a vet started on a sad note. My first pet died, unfortunately, because of poisoning malicious. And from that experience, from the sense of being powerless, I think it's planted a seed inside me so that I could get the information, the knowledge to be able to change such a situation. And fast forward 10 years, 15 years actually, here we are in the UAE practicing. All right, so the average day for Dr. Godfrey begins at 9 o'clock in the morning. We come in the morning. I just do a quick round, just check all the patients just to get a proof, like make sure everybody is healthy and alive and with us. Quick scan, downstairs, upstairs, boarding, and then from there we start to go into the details of the patients to see how each one of the patients is doing. We go over the vials, medications, check to see if we've got a good response or not, or if we need to make particular changes to the treatment of the cat. And then after that, we are open to consultations, which are on a walk-in basis, as well as a scheduled basis. So we'll deal with anybody who comes in who needs our help. And that continues up until the evening. And then before we go, we do a final check on the patients and make sure everything is in place. Right, so my journey to the Middle East, UAE in particular, has not been a straightforward line. We've had to travel through a couple of countries, Angola, Zimbabwe, South Africa, Botswana, and eventually I found myself in the UAE. And working in the UAE, it's mostly cats. And believe it or not, in this 4-year period, I've actually grown extremely fond of cats, and I find them very unique, very intelligent, very affectionate, and their medicine is it's very enjoyable, and I really look forward to seeing cats on a day. If I don't see a cat in a day, it's not a good day.
Hello, what's your name and where do you come from?
My name is Ndumisi. I come from Zimbabwe, and I work here at Vets24 as a pet groomer, a caretaker, and a nurse as well.
I see. Thank you. And what's an average day like for you here?
Basically, when I get work in the morning, I start by inspecting the animals in body, the sequence and seizure, ensure that all the animals are well. No animal is behaving in a funny way. No animal is dilated over the night. And also, I ensure that all the animals ate. And if the animal did not eat, that means there is a problem. So I jot down everything that I see in the morning, so that when the doctor comes and the assistant, I'll give them the information so that they know what is happening with the pets.
Thank you so much. Hello. And what about on the grooming side? Because I understand you're responsible for the grooming. What happens when you have an animal that may be frightened or maybe even a little bit aggressive?
Okay, basically that's the greatest challenge which we have here. So usually when an animal is aggressive, that means I will take longer with the animal. I will try by all means to make the animal calm. So the grooming, that means will take longer. So what we do, first we inform the client that your animal is a bit aggressive. So what we suggest we do, can we sedate the animal? But when the owner doesn't want the animal sedated, we make sure that we make the animal calm as much as possible, and the grooming takes longer.
I see. Wonderful. Thank you so much, Malungi. Thank you very much.
It's a pleasure.
And Malungi, I see that behind you, another room here now where you have, this is the wet area. I can see you have a stainless steel bath behind you. And can you tell me what happens here, please?
What happens here is that is where we shower the animals. So when an animal comes, after doing our inspections and everything, we'll be knowing which shampoos to use here. So when an animal comes here, there's no turning back, there's no like this, it's showered. So usually when an animal is having maybe something like skin condition, if you are showering here, you can see by the size of our tub here, that is very safe because we're supposed to leave the animal for some couple of minutes depending on the shampoo. So basically, this is what it's for.
Fantastic. And then afterwards, obviously, they're dried off and I noticed hair dryers and various things on the floor as well. Wonderful. Thank you so much. Fascinating.
You're welcome.
Hello, Malungi. So this is one of the areas. This is where you start when you have to groom an animal. So can you tell me what goes on here, please?
Okay. Yeah, basically, this is our table for grooming. That is where we put our animals. And you can see that this table is a bit advanced for all animals. So make sure that it's safe. That's why we're having all these girls. So if an animal, sometimes we have animals which are not soft. So we usually tie them here and make sure that the breathing space is okay. And then we inspect for things like teeth and also the skin. We inspect the skin to see whether it's having a skin condition or not, so that we know the right shampoo to use when we are doing our grooming.
Okay, I see. So sometimes you have animals that come in with bad skin conditions, or there may be strays who have ticks or various other things.
Yes.
I see. Thank you very much, Malungi.
It's a pleasure.
Hello,
What's your name and where do you come from?
my name is Annette. I come from Cameroon.
And what do you do here at Vets24?
I am an animal handler and a caretaker here in Vets24.
And what does that mean?
I take care of the animals. I handle them for medication and I assist the doctor in consult. When clients come in, I have to handle the animals for medication and checkup.
And what's the favorite part of the day for you?
The favorite part of the day is when I give medication to the patients and I socialize with them as well.
Wonderful. Thank you very much. And Annette, can you tell me what attracted you to working in a veterinary practice such as Vets24?
What attracted me is because I've got passion to become a veterinarian. I want to be a vet doctor as well. So I love doing the work. I've got passion for it. That's
And
why
you love animals?
I love them so much. I love them so much with passion.
That's absolutely wonderful. I wish you every success and luck in your journey ahead.
Thank you very much.
Thank you, Annette.
Okay, so I'm Neri and I'm from the Philippines and I've been working here in Vets24 for almost a year now. So basically, I'm in control of this area, the receptionist area of Vets24. So the procedure once the sick patient comes in is like the first question that I have to ask them is, have you been here before? So if it's not, then they will have to fill up this form. So it just contains some information for the owner and then the pet. Okay, so then I will have to assess the patient. If it's like critically ill, then I will have to check with the doctor so that they can assess the patient first. And if it's not, then I will just have to enter the data that they have written in this form in the database, and then I will have to check with the doctor. So aside from that, I also make appointments and I also answer questions or inquiries through Facebook, Messenger, WhatsApp, or even the phone calls. And I also keep the physical and database records of our patients. And yeah, with regards to supply, I also work with our accounts when it comes to the supply of our items here.
Hello, what's your name? Where are you from? And what do you do here at Vets24?
Oh, that's a mouthful. My name is Uchirai. I'm from Zimbabwe. And I'm a veterinarian here at Vets24.
And what's an average day like for you, Dr. Ushi?
Well, it all depends. But the good days where we're so busy, we hardly have time to sit, hardly have time to even eat. So it's just busy the whole day. And there's a few days where we really get to rest in between, and that's the time that we use to socialize with our patients and get.
Okay. Are there any particular areas that you're responsible for?
I'm responsible for the whole of Vets24 patients that are within the hospital. So that includes in boarding. We move to surgical recovery ward, but our spray ward for mostly our dogs. And that's downstairs for the general recovery area, as well as isolation.
Wonderful. Thank you very much. Good morning. And what's your name and what do you do?
Good morning. My name is Dr. Chenjerai Sigauke. I'm from Zimbabwe. I'm a veterinarian.
And how long have you been a veterinarian?
I've been a veterinarian for 22 years. I graduated from the University of Zimbabwe and have been practicing small animal medicine and surgery ever since. I also have a master's in small animal medicine from the University of Pretoria.
Wonderful. And why did you create Vets24?
Vets24 was created in order to provide comprehensive veterinary services to pets in Ras Al Khaimah. We were also created in order to be a clinic that is available to pets and pet owners 24 hours. We close usually at 10 at the moment, but we are still available for emergencies even after 10.
Wonderful, thank you. Dr. Chenjerai, do you only work with domestic pets or do you work with larger animals as well?
Our main focus is domestic pets, cats and dogs, but we also deal with other animals like exotic animals. We also deal with some farm animals, camels and horses as well.
And how many vets do you actually have here in the practice?
We are a team of 4 vets, 2 senior veterinarians and 2 assistant vets. But all our staff complement is about 12 people, including all the support staff.
Thank you very much.
You're welcome.
Hello, Dr. Chenjerai. Now, we're in one of your consulting rooms. Can you give me an idea of what an average day is like for you here at Vets24?
Oh, every day is different, but our average day starts at, for us veterinarians, starts at 9 in the morning when we do our rounds, checking on our inpatients, making sure that they are responding well to the treatment that we have given to them. And we then start to accept consults from around 9:30. Most of the consults are by appointments. So the first part of the morning, from 9:30 to around 12, we'll be doing consults. And from 12 to around 3, we'll be doing surgeries. And then after 3, we do consults again until it was.
Wonderful. And of all the different services that you offer during the day yourself, what's your favourite part of being a vet?
My favorite part is when I'm in the theatre doing surgery to animals. I love surgery, and I think that it really provides almost instant relief to the animal, and this is what I really like about it.
Wonderful. Thank you, Dr. Chenjerai.
You're welcome.
Hello, Dr. Chenjerai. And what is this area here?
Hi, so this area, this is our treatment area where we give medications to the animals, where we check animals that are inside the clinic, we check them in this area.
And I noticed that we have 2 doors that are closed here. What are these areas here?
So this is the surgery room where we do all the surgeries. It's quite a sterile room, And the next room is the X-ray room. That's where we do the X-rays.
Okay.
Then, if you look through there, that's where we keep our inpatients.
Okay, so straight ahead and around the corner
Yes,
is where you have
around the corner.
inpatients.
Yes.
And upstairs?
Upstairs, we have the grooming area, and we have the catering and another place to keep animals as well.
Okay, so like a recovery area as well.
Exactly. Yes.
Wonderful. Thank you very much. Hello, what's your name and what do you do at Vets24?
My name is Jeff Tachibwe. At Vets24, I have three major tasks. These are procurement, bookkeeping, and picking and dropping off animals.
And can you tell me a little bit about procurement?
On procurement, I will be buying the necessary medication which are needed by the doctors to treat the animals. I will be also buying the required equipment which are needed also for treating the patients.
I see. Wonderful. Thank you very much, Jeff.
You are welcome.
Well, Jeffita, and can you tell me what is the procurement side of your business then?
The procurement side of my business is to buy the necessary or the required medication for treating the patients, and also the required equipment for treating the patients.
I see. Lovely. And you're also responsible for bookkeeping?
Yes,
So you're the person that at the end of the month you tally the books, you do the receivables and you do the payables.
sure, yes.
Okay. And you said that the third part you do is that you actually collect animals. You collect sick animals from people if they can't get to the surgery.
Sure, yes, we do that one.
Okay, wonderful. Hello, and what's your name and where do you come from?
My name is Norman Nawaz. I'm from Pakistan. So my job is here, the cleaner. On the cleaning is my responsibility, the downstairs and the upstairs. So I do my work. My job is very good job.
Wonderful. And I would have thought that sanitization is very important so that there isn't any cross-contamination. Could you explain a little bit about that, please?
Yes. This is a very important thing. So we have the more things for cross-contamination and the disinfection for bacterial infection. We have more solution for the downstairs, the separate, and the for upstairs for separate, because of bacterial infection can come.
Wonderful. Thank you very much. Okay, and Norman, can you tell me, I would imagine that when sick animals are now better and they leave here and they go back home, it's important for people to keep their environment clean as well. Could you tell us a little bit about that?
Yes, ma'am. This is very important because the bacterial infection is a very bad infection. Okay, so here we have advice for the customers, for clients. If they bring the pets at home, they clean the cage. They should be more careful because here we have for bacterial infection the separate cages, and the normal pets here is the normal cages. Okay.
Thank you very much, Norman. Thank you.
Hello from Vets24. We have a new pet shop, and for those who are wondering where the new store is, let me just take you to the location. It will only take a moment. And we have arrived! Vets24 Veterinary Pharmacy offers a wide range of pet supplies for cats, dogs, birds, and many more. We also hold the best equestrian equipment, supplements for horses, camels, poultry, and many more farm animals. We have an experienced equestrian vet who has a major love and passion for horses, available for farm visits, consultation, and guidance in equestrian welfare. Call us on the number below, and we hope to hear from you soon. Thank you so much.
Feel like sun on my skin. This is love. I know it is. I know it sounds super cliche, but you make me feel some type of way. This is falling, falling in love. There's not much to do when all I can is thinking about you. Not doing well, don't know where you are, 'cause you're not here. It's been way too long. If I could lay down beside you, I would. When nothing really matters, that's all I wanna do. I hope that you are safe and that I will see you soon. If I could lay down beside you, I would. We talk on the phone every night. Love to hear your voice. Not sleeping well. And I know that you're right, but you should know it. You've been gone for way too long now. If I could lay down beside you, I would. When nothing really matters, that's all I wanna do. I hope that you are safe and that I will see you soon. If I could lay down beside you, I would. Even if you're gone, I won't forget you. You're all I know, what I need, and that ain't changing. And even if you're gone, I will remember. You're all I know.
Hi. Humble.
Big shop for small dog.
My baby, my Valentine. Can I hit the make
Having so much fun.
If you leave me a good time, I swear. You are like the oxygen I need to survive. I'll be honest. I'm loving the thought of you.
Look at the accessories.
I'm so obsessed. I want to chop your heart.
Let me see. So many to choose from. So many toys. Let's check out the food.
Without you, I
Round
could
three.
feel lose my mind. Without you, I could feel fall and die. Without you, I could give up my life. Without you.
Those beds look so comfy. Best shop ever.
Vets24. Today we are introducing to you a new addition to our equipment. Is the 5-head dental machine. So I'm just going to demonstrate and show to you some of the components of the machine. So this machine has the high frequency scaler, which is used to scale and remove tartar from the teeth. So the scaler also has got a function of producing water, so that when you are scaling, it cools down the teeth as well as remove debris from the surface of the teeth. The next component is the high-speed drilling head. This component is used when doing extractions. In order to extract teeth from a cat or from a dog without causing a lot of tremor, you always need this machine because it makes everything easier. It makes the extraction easier. So we have our machine has got a high-speed drilling head. So after scaling, usually the surfaces of the teeth are a bit rough. You need to polish and smoothen them out. We do that with the low-speed drilling head. So this is a low-speed drilling head used for polishing the teeth. Oh, the machine is just says that we're doing something there and then just pick up. Okay, the fourth head is called the suction head. This suction head is used to extract water from the mouth. You know, when you are scaling, there's water in the mouth. You don't want the cat to aspirate this water. So this suction head helps to suction it out from the mouth. And the last component is the flushing head. The flushing head, after scaling, there's a lot of tartar which is lying around in the mouth. You use the flushing head. It has got two components. You can use water, you can use air, or you can actually flush with both water and air. So thank you very much for watching this video. I hope you found it interesting, and see you next time. Everyone, welcome to the second part of the dental series. So we have this case here who came in for dental scaling. So when animals are undergoing dental scaling and polishing, they're always under general anesthesia, and we monitor them with the patient monitor to make sure that everything is safe. So I'm just gonna demonstrate to you what we do when we're scaling. Suction. called a corn's neck. It has been presented to us almost 27 hours after it started laying eggs, but unfortunately it could not lay all the eggs. It still has got some eggs remaining. You can see at the back here there's some bulges. All right, okay, all right, okay. Can someone help me to help, please? All right, okay. So you can see that it still has got some eggs here. So we're going to try to help her to deliver the eggs in a non-invasive manner. So we're administering into the intracellular cavity, or what we normally call intra-abdominal in other animals. So it's like 10 mils of normal saline.